Welcome to Moving Science, the podcast where we dive into the latest breakthroughs shaping the future of medicine. I'm Dr. Agne Straukiene, a neurologist and MS service lead at Torbay and South Devon NHS Foundation Trust in the UK, and the founder and host of the Be Well with MS podcast. Today on Moving Science podcast, sponsored by Roche, we are taking a closer look at how technology is transforming education in healthcare. With new tools emerging all the time, it's changing the way professionals learn and stay up to date. We are going to explore how this is helping improve patient care. I'm excited to introduce our special guest, Professor Heinz Wiendl, a leading expert in neurology and neuroimmunology. Starting in October 2024, he will take on the role of chair of the Department of Neurology and Neurophysiology at University Hospital Freiburg. Professor Wiendl's career is full of impressive achievements, including his time as director of the Department of Neurology at the University Hospital Münster, where he made major contributions to multiple sclerosis research and care. He has received many honors, including the Sobiech Senior Award for MS Research and the Heinrich Peter Award from the German Society for Neurology. With more than 750 peer-reviewed publications and a lasting impact on the career of many in the field, his work is extraordinary. Today we have the privilege of hearing his thoughts on how technology is changing healthcare education and helping both doctors and patients better understand and manage modern medicine. So I can't wait any more longer. I would like to bring Professor Wiendl into this discussion and have an overview of AI tools used in education.
Hi, Agne. I'm very pleased to be here, and thanks also very much for this super kind introduction. I'm getting nearly a flush.
Aw, bless you. Well, this is true. This is your real bio, and we can't hide anything. We just have to present with an honor, and we really appreciate for your presence and attending this podcast. So today we would like to maybe start with a bit of it telling about your new role at the University Hospital Freiburg and what excites you most about the next chapter in your career.
Yeah, I guess Freiburg is a very reputed place to start with this, and they have a good vision on transformative impact that university medicine should make. I mean, we've come quite far from concepts how to really bring research into a value for the patient. And the classic way is starting with whatever experiments in animals or in cultured dishes and hoping that sooner or later those things might make it into some value for the patient. The strategy, however, I think changed on a larger scale, and particularly the vision in Freiburg would be to have something which I call reverse translation approach. So that means you start the question, but also the research with the patient or the patient-derived material or the patient-derived data, and then going deeper and reverse into mechanistic explanation. I believe, and that is also the concept in Freiburg, that the value of really doing intense research with the humans and affected persons shortens the time until you get really the value back. So I'm not sure I made myself clear, but the vision is really to better and more precisely define neuroimmunological diseases and particularly multiple sclerosis. So it's a way of precision neuroimmunology, which brings us to the topic of today's podcast. The other thing is a center for neurological immune therapy, and this is what Freiburg is very famous for. They have an extensive experience and track record in immunological deficiencies and in immune-related disorders, and this is a good match also with the, let's say, neuroimmune disorders.
Wonderful. I think, Heinz, you are focused on producing a good quality of research and further science. And I think today we have to talk about the extensive background of yours in neurology and neuroimmunology. But our topic is, how have you seen AI, artificial intelligence, begin to influence these fields in neurology and neuroimmunology? What is the role of AI?
Definitely an increasing one. I mean, maybe to start with something simpler. I mean, several years ago, we noted that the complexity of data sets in our research projects, they simply needed novel approaches to tackle them. And things like machine learning, building neural networks, deep learning, this is all elements that are under the umbrella AI. And we're doing this since a couple of years. I mean, AI is in the general lay publication often considered something, yeah, mystic and different, chatbots and robots. But in a way, a lot of analytical tasks, they exploit already AI because they wouldn't be handleable with just the classic ways of analyzing. Just to give you an example, I mean, in the early days, we assessed one molecule and correlated it to whatever. And you can use simple tests because that's pretty monodimensional. But now you're so multidimensional with the n of samples, but also the n of items, and that is not anymore to be handled. The other point is that we're moving a bit from hypothesis driven research to hypothesis free research. And if you're hypothesis free or at least semi unbiased, you need completely novel ways to analyze it. And this is where AI comes into play. So I would say, to answer your question, it has arrived, particularly in the research field, already since a couple of years. And it's now more and more arriving in things like, would that not be something that in patient care related questions or in diagnosis and therapy related questions, could it not be of immediate and more direct help?
Wonderful. In this episode, we will explore the impact of AI on healthcare education, the ethical consideration it brings, and how it's being regulated. This is super important, I think, and the way we look at the digital tools is actually trying to assist the healthcare providers and the patients. Can you give us a brief overview of how you see AI transforming the healthcare in the near future? What is your insight looking into the future?
Yeah, Agne, there is a lot of expectations in AI. On the other hand, a lot of challenges, and there is a lot of promises and there is a lot of hopes. But when it comes to concrete examples, we're not yet that broadly looking at too many examples where and how AI has transformed healthcare. There is very simple examples like, can AI support things like better organizing patient care from an administrative standpoint? So, patient appointments or voice recordings transforming or transcribing into text. So, this is more things that have nothing to do with the specific field of medicine or healthcare. It's just a very usual suspect of where AI builds its power, because it can significantly reduce the burden of routine work and can improve logistics and stuff like that. Your question is a different one, I guess, is when and how does it arrive in real patient care related issues? And we're talking neurology. We're talking particularly multiple sclerosis. And I would say here, it has not yet arrived in every daily practice example. In other fields, this is a little bit more advanced. Look at dermatology, where AI tools help in pattern recognizing skin lesions. Yeah, so you simply take a photo, you send it into a big cloud. They're comparing with whatever data repository, and then they give you likelihoods of this could be a melanoma or not. And here it has already arrived in supporting diagnosis. I should, however, and I guess this is a very important preamble, say that I believe that AI still has to be handled with a level of expertise to know what you can expect, because AI should not replace the healthcare professional, it should support the healthcare professional. And therefore, I like the idea that it is the most welcome co-pilot in many questions related to diagnosis and therapy. But it's never like something mystic that replaces the expertise or the final decision making of the neurologist. We should still try to, I would say, control about it in a way that medicine is not like a robotic task in many ways, particularly if you talk about the discipline like neurology, where there's a lot of language, empathy. And I don't see that so quickly replacing a human doctor. But all the tasks a human doctor has to fulfill can be supported in many areas with the help of AI. And this is, I feel, the realistic promise that I'm looking forward to.
Yeah. That sounds very, very promising. I think that AI is supplementing doctors' workflow and the heaviness of day-to-day routine that we have with a huge amount of information that we have to digest. So this tool is actually helping to segment the given data and help us to make smart decisions without replacing the human beings, because AI is not that clever enough to replace the doctors. And there are so many ways of using AI, whether it's transcription of the spoken language, whether it's interpreting the images and data, as you mentioned, from cancer images of the skin or any other visuals. MRI scans or CT scans can be interpreted by AI tool. Perhaps it is still early days. I have various different opinions in terms of the quality of the analysis of the images in particular. Perhaps it's very advanced in cancer, in the skin cancer, but I'm not quite sure whether, in particular given the MS field, whether AI is going to replace radiologists. I think there must be some more work to be done to evaluate the validity and the sensitivity of this tool. I think it's good for the brain atrophy assessment, but not that good enough to quantify the number of the new lesions appearing as parts living with multiple sclerosis.
The very obvious and very, very much prominently described use case is really automated and AI-assisted imaging reading, because this is what AI is particularly good in, is pattern recognition, huge data sets, comparing it, and therefore it's very clear on the surface to say, shouldn't that be better than a human individual looking at numbers of lesions or in subtle changes on brain volume? So shouldn't that be something AI power could exert its real value very easily? The problem is, and this is definitely a strong use case, and there are companies out there that are already having commercial, partially CE registered products to do something like automated AI-assisted imaging analysis for example, multiple sclerosis. But don't underestimate that it's still not an easy run, and it will not be done without a radiologist in a way supervising it, because it depends on the training data set. Is the training data set robust and big enough? It depends on the quality of the scans that are then imputed into this analysis machine. And I guess this is getting better and better. We're still, in a way, albeit this is already running since many years, in the starting period. But what also is true for many other fields is that the incoming quality of the data that in the end generate the training data set for whatever an AI tool is then to produce or to help with is key. I guess this is one of the key learnings also in my journey to AI. The first question is, how and with what did you train this model? And is it robust enough? And is it not just a nice sounding use case? Is it robust enough to really be better than the standard? And MRI AI imaging analysis is a very good example for that. I guess this is definitely a very strong use case, particularly for MS, but it's not as easy as you think.
Yeah. Continuing on the challenges, I guess there are so many different challenges, and we covered a few here. And I guess as a healthcare provider, we are getting influx of the information available online. Especially, it becomes challenging when it comes to identifying credible resources, and equally the same verifying information that is AI assisted for healthcare professionals and the patients. How can we make sure that we are getting access reliable information, even if it is AI driven?
It depends on what use cases we're talking about. So if you're talking about a imaging analysis tool, then at some point patient derived images have to come and they train the model. And there is a starting point where you have to have a project that is based on an informed consent and so forth. There is other AI area which are so-called clinical decision support systems, where patient derived data, they could include imaging, but also lab data or clinical data, are all feeded into whatever algorithm, and they can support you in decision making of whatever kind. It could be the diagnosis, it could be the treatment. And again, here, the source data have to be reliable and they have to be big enough and they have to be standardized. It's not that AI can very easily digest that then also has to be in a way curated by human. A tool that I'm very deeply involved is how can you provide doctors or healthcare professionals with validated medical information that does not necessarily be just the patient-derived information. It's, for example, a guideline is definitely of higher value than a Wikipedia hit. And that's the problem with things like Google or ChatGPT, that they have a wealth of information, but are they all trustworthy? And are they not biased? And this is one approach, I guess, is very important. Are the sources, are the repositories of those tools really valid? Are they trustful? Are they truthful? And this is something that is clearly an aspect. Would you be allowed to use them in a medical professional context? If you ask yourself, so does, for example, vitamin D really help in treating multiple sclerosis, then you would not like to rely on what's written in the broad internet. You would like to rely on what does the medical evidence base really provide you as an information. And then it's very important that the sources of such a prompt or query are trustworthy. And this is exactly what, for example, the AI endeavor I'm engaged with is trying to do, to reduce to a percentage of information in the medical field that is completely acceptable. Yeah, things like guidelines, like the official product dossiers from the regulatory agencies, the prescription information. I mean, this is official documents. They are really reflecting the majority opinions. And I guess for all sorts of medical information, which is a huge element in what we're doing in multiple sclerosis care. I mean, you also know in your clinic with what informations patients come up with, and how can you convince them that this is not something that was in the yellow press, as opposed to it's based on a robust guideline committee that had to go through a very complicated process of finding a consensus and then a recommendation.
Absolutely. And I think a decade ago, we were competing with Dr. Google. Now we are moving into the era of competing with maybe Dr. ChatGPT and many other LLMs available widely. So we have to be very careful. And if you're a patient listening to this episode, just bear in mind that the tools that are widely open and available, you really want to double check that with your healthcare provider before you make any decision. Because as you know, open access AI tools may be misleading. Sometimes it produces hallucinations and delusional thoughts and ideas. So So it's better to get this checked with a healthcare provider before you conclude and make decisions towards your health, because there is nothing more precious in this world than your brain health, your health, general health, and be sure that you check on information on the trustworthy resources. So as we wrap up the segment one of this episode, which illuminated discussions on the role of AI in the healthcare management and education. So I would like to extend my deepest thanks to Professor Heinz Wiendl for sharing his expertise and vision. Stay tuned in, and there is a second episode on the same topic where we're going to discuss about the more extensive, more detailed information about the making diagnosis, ethical aspects, and implications using the AI tool. I hope you're going to enjoy that. Stay tuned, and thank you everyone for listening this episode.